Welcome back to Plastic Surgery Untold, greatest podcast in the world as voted by us. I got my med spa dream team here. So we got one PA, Gilbert, also known as Austin's most beautiful man, coming in strong today, really strong, looking good.
Thank you.
Sarah, you're looking fine too.
Thank you so much. Thanks. Yeah, it's hard to keep up with Gilbert.
Yeah, but today I want to talk a little bit about cellulite, one of our favorite topics. Obviously, you know, we're all about butt stuff. And so, you know, what's been interesting, cool, and challenging all at the same time has been the weight loss revolution. You know, we've seen a lot of patients that are living their fit and fabulous life. We've seen more of a transition for this whole luxury legs. You know, people wanting their lower half since leggings. These things haven't gone away. You know, just wanting to look super toned. And unfortunately, a lot of people tend to perceive that if you have cellulite or dimples on your butt, that you're unathletic, it's unfit. That's not true. Not your fault. And it's not because you didn't do enough squats growing up. And so one of the combinations that we've absolutely loved has been the combination of Aveli and Sofwave, both FDA indicated for cellulite treatment, but work very, very distinctly. So if maybe one of you wants to talk a little bit about that, and then we can talk about the differences and why they actually work so well in combination.
Yeah, absolutely. I can start if you want. I love your point about the fact that just because you have cellulite dimples on your booty doesn't mean you haven't done enough squats. A ton of my patients talk about how they've had the cellulite since they were in their teens, when they were at like their most fit and fabulous ever, you know. And we
see some patients that have BMIs of 22. They're absolutely in phenomenal shape and still have cellulite. So we see the full spectrum.
Yeah, absolutely. I think weight definitely does not indicate whether or not you're going to have cellulite. Thankfully, there's been a lot of research done lately on why we have cellulite and what causes it. And we know it's caused by those fibrous bands that are really tethering the skin down. So it doesn't matter how many squats you do or how low or high your weight is, you're still going to have those dimples if you do have them. So the Aveli is great because we're able to go in and actually release those bands and then verify that they're gone. So really great and pretty significant improvement there. But just like you mentioned, most people have some skin laxity as well as the cellulite. So maybe Gilbert can touch on how the Sofwave is such a great combo to actually address that as well.
So, yeah, absolutely. Happy to jump in.
Thank you.
Sofwave, which uses ultrasound technology, which, as you may know, is one of my passion projects. But this is a different kind of ultrasound in the sense that
Which is confusing sometimes to people because there's the visualization, there's the treatment, just very different.
Exactly. And so in this case, what we're doing is we're utilizing the ultrasound as a form of energy to help stimulate collagen production in the dermal layer of the skin or the layer that's just below what we can see on the surface of our skin, which is where the collagen is produced. And so utilizing this technology in combination with Aveli not only helps give us better outcomes, but it helps really kind of tighten, tone that black skin, which is what sometimes I think a lot of patients mistakenly assume are cellulite dimples as well, when in reality it's just a little bit of loose skin
that's
just happens.
Phenomenal point, and not just patients, sometimes providers too.
Yeah, and so we have over time kind of developed our degree of expertise to be able to identify what truly is a cellulite dimple versus what is skin laxity, and we are able to then explain that to the patient in a way that they can not only understand it better, but visualize it themselves.
Yeah, I was going to jump in and say, and also I love that we can do these on the same day. So I actually just had a patient yesterday in the office that I did this exact combo. This is one of our luxury legs procedures. We love to call it that. But the great thing about combining them is with the Aveli, we use an injectable tumescent fluid that works really, really well for pain control. So I love to point that out because some people think Aveli looks scary. It really should be a comfortable procedure. Most of our patients are hanging out, FaceTiming their friends or shopping, should be pretty comfortable. You're going to experience some tugging, pulling, and pressure, but it shouldn't be too painful. And then now you're already really good and numb from the Aveli procedure. So immediately, as soon as we're done with that, we can go in with the Sofwave using that ultrasound energy that Gilbert brought up to really create that kind of controlled thermal injury so that we can wake up those cells that make that collagen and elastin and help to re-tighten up the skin. Gilbert is our collagen expert. He was talking about how we lose so much collagen each year as we age. So we see a lot of those changes in the skin. And then if you're losing weight as well, then, could be even more so if you're on the weight loss revolution. So being able to do these treatments together, one, we can start that process because it takes time to see the results from the Sofwave, right? For that new collagen to really be built. But also it's much more comfortable because you've already got the injectable tumescent, and then we'll do a full treatment. So even if we're treating other areas of the butt and thighs that maybe we are not releasing cellulite in, we will still add that topical numbing to that area as well towards the end, so we can do your full treatment same day, get it done, and get you ready for your summer bikini.
And I think you guys have both touched on one of the real keys here is a lot of times people refer to their butt as cellulite. There's so many factors, and this is some of the stuff that we help them through because, it can be the Aveli, to release the true dimples. And Aveli I love because it treats the true cause of cellulite, which is the fibrous bands that are pulling that skin down. But if you think about it, if your skin's really loose, even if you release those bands, there's a limit to how much that skin's going to tighten, pull that skin up, and get you into a great spot. And then sometimes people have a little bit of volume loss, some targeted volume replacement can help as well. So I think it's much more complex, which is super exciting, super challenging. But as we always say, where there's challenges, there's opportunities to improve this. It's such an area in the whole center of the weight loss revolution. You're going to see more and more skin laxity of the buttock and thighs. And I think if you're not addressing both of these, I think people are going to be a little disappointed. And super cool here because it's such a phenomenal treatment. Unfortunately, or maybe fortunately, depending on how you see it, bikinis don't seem to be getting any bigger. I think people they're living this transition in terms of their fit and fabulous life, and they want to be able to show it off and look great in terms of this. Talk to me a little bit. So Aveli, for the most part, is considered a one-time treatment. What about the Sofwave or RF microneedling if you do some type of skin tightening for the buttock and thighs? Is that a one-time? Do you have to do a series of this? How does that work?
I think if I can jump in, I think
Sure.
I think it depends on the patient. Depending on the degree of skin laxity or the severity of the skin laxity, I do tend to overestimate just because you can, in my opinion, you can always do more and have a better outcome. But if you don't treat enough, and patient is maybe not going to have the results that they're hoping for. And so I typically will recommend a series of 2 treatments of Sofwave separated by about 6 weeks apart from each other, and at least a series of 3 RF microneedling treatments about 4 to 6 weeks apart from each other.
I feel like nobody says, gosh, my butt is just too perky and too firm.
Exactly.
That's what I was going to say. I agree.
But a lot of this also depends on, and I think you're alluding to this, where they are in their journey, right?
Yeah.
So if somebody's trying to lose, 60, 80, 90 pounds in terms of this, probably going to need multiple treatments over that journey to get to a good spot in terms of their skin tightening. Both of you have already alluded to the collagen loss. So unfortunately, as we age, our butt doesn't go up, tends to go the other way. And so even when you get to a good spot, something that you may do once a year, every other year, depending on kind of how you're toning and doing some of those things. Absolutely.
I think, we talked about this in one of our last episodes where, for the most part, we're in the beginning, we're trying to play catch up with everything that we've lost, right? And then it's more of a matter of, just maintaining everything. Sarah, would you agree?
Yeah, absolutely. You made a good point about the Aveli is typically a one-time treatment. Once we release those bands, they should be good, but the skin laxity doesn't stop. And a lot of, like you said, patients or providers confuse cellulite with skin laxity. So, if you tend to notice more of a wavy appearance, if it's been a couple years since you've had your cellulite treated, the chances are you've just developed some skin laxity, and we can improve that, right? So, or if you want to prevent that from happening, then let's just get you on a maintenance plan. Let's do that initial series for the skin laxity or for tightening up that skin, improving the tone and texture of it as well. And then, I have patients ask, how often should I do that? I love the idea of doing just one treatment a year to help maintain. Or if that doesn't work for your schedule, then we can also, if you go a couple years, you'll probably need to repeat this full series. But whatever works for you, definitely you'll be looking at something as far as maintenance goes because we can't stop you from aging.
Can we talk about a little bit about surgery? Because I feel like that's my passion stuff. But a lot of people are like, well, I don't know if I want to do Aveli or Sofwave because I'm going to get a BBL anyway. But I think that couldn't be further from the truth, because if you think about it, we've transitioned, just as we've talked about previously, from the face, where we used to just fill our faces as much as possible. Not our team because they're fabulous, but people would just get overly filled because they thought if we just add volume, that'll take care of all the wrinkles, that'll take care of all the issue stuff, everything will be fine. And then we got these big old blown up up faces, and so, which wasn't super attractive. Same thing with the butt, with the world of BBLs, when it first started, every conference talked about, well, how much fat can you put in the butt? And we just made these massively big butt stuff, and they can't lie, but other than that, wasn't exactly where we've transitioned to. Now it's this modern BBL, we talk about the Pilates Peach, but I think the more that you can smooth that butt with the Aveli, the more you can tighten that skin envelope, just like we do in the face, then we can do some fat transfer to really just shape and improve the overall form of the butt and get you to a great spot. I also do think that pre-treating the butt with some of the Aveli releases some of those bands. It lets us open that butt. If you really look at someone that has a lot of cellulite, they tend to have more of a collection centrally and medially, inferiorly, and then that also tends to be where the butt's the flattest. To me, it's not a coincidence that the flattest part of the butt is where you have the highest collection of cellulite. That's why I love to pre-treat people. That's why I want to address some of the skin laxity and then come and do the fat transfer. If you've missed that boat, it still hasn't changed, because I do think when you release some of the Aveli and you do some of the skin tightening, as Gilbert said, you do get some fat remodeling over time underneath that will improve that. And then if you need to come back and touch that up with a little bit of biostimulant or something new that's coming in a couple months stuff that I'm still not going to tell you about yet, but it's coming. There's going to be a way to treat some of those things a little bit more effectively than we've ever been able to in the office. So some really cool stuff coming, but I think it's really cool how you can do all of that. Maybe really quick, and one of you guys can take pre and post. How soon before BBL should you treat somebody with Aveli or Sofwave?
Yeah, if you've got a BBL coming up, we want you to do that ideally at least a month before.
2 weeks is kind of the hard limit.
Yeah, exactly. Like ideally, we'll line you up maybe at your pre-op. You typically would see Dr. Franco or one of our other incredible surgeons about a month before your pre-op. That's a great day to pre-schedule your Aveli. So talk to your coordinator about that. We can, if you're traveling in, we can make it happen the same day. We want to take care of you, make it as easy as we can. And then, if you didn't pre-treat before, then you can do it after. Gilbert, when would you say is the best time?
I don't think it would be wise to do it any sooner than 6 weeks post-op. I think 8 weeks would probably be the magic number.
Yeah.
But anything sooner than that, everything's still kind of starting to heal and settle in, and you could disrupt some stuff.
100%. You don't want to mess with the fat. You kind of want to let the dust settle so it can be super precise in terms of the treatment stuff. I think even for the skin tightening, you want to let that swelling go down, because if not, you're fighting against yourself a little bit. So 100%. And I think sometimes people don't realize, remember BBLs, because we've changed to using some of these bigger cannulas, blunt tip stuff things, while it's made the procedure extremely, extremely safe in combination with the ultrasound that Gilbert alluded to earlier, they've been made to not disrupt the vessels, so it also doesn't disrupt any of the fibrous bands. We also tend to do the fat in that deeper fat compartment, which is actually not where the fibrous bands attach. So a lot of times people think, oh, this gave me cellulite. No, your cellulite was there. You just now look at your butt all the time and you still see it. And I do think if you increase the volume, it does put some tension into that, so you see those cellulite dimples a little bit more. Again, why we try to get people to pre-treat. But if you notice it more and it really bothers you, no question we can do it. Just got to be a little patient to get you to a good spot.
Yeah.
Any final kind of butt questions? Because I love this. I mean, the whole Pilates Peach idea is just super fit, super fabulous, but that really involves the combination of skin tightening, form, which is the cellulite release. And then, we can add some structural volume and support if we need to, but not just being dependent on just the hammer of just adding a ton of volume.
Yeah, absolutely. I was going to say that's the last thing I would probably add is, if we've treated your cellulite, we're working on tightening up that skin. I really think the icing on the cake, or almost putting like a filter on the skin, is adding that biostimulant component, whether we're using some Sculptra or hyperdilute radius. We can do that at the end of your treatment or while we're doing the series. What I've found is it obviously helps stimulate collagen and elastin in that sandwich component. So we're treating deeper and more superficially, but it really just makes the skin look better, right? So obviously from the collagen and elastin, but it tends to make it look like it almost literally has a filter on it. So who doesn't want that?
G, any take-home points for all your fans?
Well, just to kind of piggyback on that, and maybe this is a topic for another podcast episode, but biostimulants, are one of the bread and butter of my practice, or one of the treatments that I consider, one of the most common ones. But one of the things that I've kind of started using a little bit more is Renuva, which helps stimulate your own fat cells to grow. And so for, volumization, I think that might be something to talk about, maybe not in combination, but as a treatment option to what you are holding so close to the vest in terms of.
And if you like Renuva, you're gonna love what I have coming soon. So maybe Gilbert's been checking my message and stuff. So the issue with Renuva has just been the limit stuff. But I'm not gonna give you too many teasers. It's coming soon. We actually got a meeting this week. If you love Renuva, something's coming soon. Yeah. Cool.
Yeah.
Awesome. Well, Plastic Surgery Untold, greatest podcast in the world, as voted by us. You can listen to us anywhere you get your favorite podcast, iTunes, Spotify. If you want to see Austin's most beautiful man, i.e. P.A. Gilbert, feel free to check us out on YouTube. We'll see you guys soon.